Hi friends, welcome back to my YouTube channel. I am Dr. Vijayant Govinda Gupta, a penile implant specialist in New Delhi, India. Today we will talk about penile implant infections, why they are bad, what do we do in our practice to prevent them, and why we have been able to keep our infection rates in penile implant to less than 0.1%. We are proud to tell you that in the past 2 years of penile implant prosthesis surgeries at my center, where we have done more than 400 cases, we have not had even a single instance of a penile prosthesis infection. Now, why is infection bad? Now, penile implant is a foreign body. We are placing it inside the penis. The penis is a mobile organ. It is not stiff like the knee joints. So, the penile implants tend to get infected. These infections will usually come in from the skin flora, and if the implants get infected, then these bacteria tend to form a biocapsule over these implants, and because of the presence of a biocapsule, these infections don't resolve. Even after prolonged antibiotic uses, these infections tend to continue and fester. These infections can get bad, leading to problems like strictures and fistulas, and most implants, once infected, have to be removed en toto. Once an implant has been removed, putting in a new implant becomes very difficult, and the patient not only loses his current erection but is not able to get a benefit of an implant later in life. Many of my patients which come from foreign countries have gotten their implants at centers that do not have adequate infection control practices, and because of that we have to remove their three pieces and put in salvage procedure, and we put in a malleable, and then these patients then require accessory surgeries like stricture correction or fistula correction or skin debridement, and it becomes a very messy job. So what is required and what was thought to be when we started our training was that when you do the implant the first time, do it well, do a good job, and prevent any chances of infection in the implants. So today we will talk that why or how can we reduce infection rates in the implant, and as I tell you the steps, I will also tell you that all these steps are utilized at our practice so that we give you a good job every time. So before we even start thinking about putting in an implant, we need to optimize the patient. So optimizing the patient is the first step of preventing infections. We make sure that every patient who gets operated from us is completely optimized. His diabetes is in control, his blood sugars are in level, his hypertension is in control. We make sure that his cardiac status is good. We make sure that if he is on any blood thinners, those blood thinners are stopped, so that post-operatively there is no hematoma, there is no blood collection, preventing any infection from happening later. We also get the patient's urine culture and urine routine to be very sure that the patient is not harboring any UTI that can cause problems later. We will always examine the patient and see that there are no cuts or there are no sores on his penile skin, so that we don't get a sudden scare inside the operating room and then we have to do the surgery in a compromised state. So if we have a well optimized patient with very good preoperative parameters, then our half the job is done. We have reduced our infection rates by 50%. The next step comes is with the operative room settings. So double autoclaving all our instruments, using ETO for all our consumables, making sure that the hospital infection practices are in place. Our OTs that we utilize for the implant are fogged in the night before the surgery. The implant surgeries are always done in the first case in the morning so that everything is fresh. We keep as less of instruments inside the OT so the OT space is not compromised. We do not allow the entry of personnel inside the OT other than essential staff. We have the OTs with HEPA filters and with outwards laminar airflow so that there is no entry of bacteria inside the OT. We make sure that all our operating personnel, including the surgeon and the assistant staff, does not have any coughing, cold or any practices, so these people are given an off. We make sure that the scrubbing and the cleaning protocols for the wash-in before the implant is strictly followed to 10 minutes. So all of these factors make the preoperative preparation perfect to put in the implant. Then intraoperatively we use something called as the no-touch technique that was popularized by Dr. Ide. We make sure that we cover the penile skin area with a IOBAN to prevent any exposure of the implant to the skin flora. We also make sure that the implant is placed in as fast as possible in as short as a time to prevent the bacteria from entering. We utilize good quality preoperative antibiotics and make sure that the implant is coated with antibiotics before the placement of the implant. We use the best quality antibiotics for irrigation of the crura and irrigation of the suture or the skin area before the implant placement, so that we don't end up with any infection. So this is the intraoperative steps that we take to prevent any infections. Post-operatively, we place a drain, we close the entire space in multiple layers and use very fine sutures so as to prevent any formation of any dead space which can lead to infections later. We also use something called as a snug dressing to prevent any formation of hematoma. So the utilization of drains and a very tight dressing prevents any hematoma formation after the surgery, and this also leads to less infection rates. Then in the post-operative period, we continue the patient on good quality antibiotics. We make sure that the room in which the patient is not visited by many people. We also make sure that infection control practices are utilized in the post-operative period, like regular hand washing, regular room cleaning, and keeping all our surgical supplies and dressing supplies as clean as possible. Because of the utilization of these hundreds of steps, and doing the implant surgery over and over again, we have been able to assure and make sure that our infection rates are zero. So if you're looking for a penile implant surgery, just looking at the cost is not sufficient. You need to make sure that the hospital or the doctor who's doing your implant is following the best infection control practices, because an infected implant is a useless implant. So if you're looking for implant surgery and you want to get it done in New Delhi at my center, you can always contact me on the given phone numbers. You can write to me on my email. You can also communicate with me on Facebook, WhatsApp, or leave a comment below. Thank you for listening in. Take care.